So I'm going to wash my hands and put PPE if indicated. Washing hands helps to prevent the spreading of microorganisms. So, hi ma'am. Good day. I'm Wensi, your nurse today. How are you? I'm good. So, what is your name? I'm Princess Eliza. So, Ma'am Eliza, we're going to do an assessment about your thorax, cardiovascular aspect of thorax, and breast. Is it okay with you? So, I'm going to close the curtains and door to provide patient's privacy. So first, I'm going to assess your thorax. Please breathe normally as I observe your respiration. So, as I observe, you breathe comfortably. So, ma'am, please turn around. So, I'm going to assess your anterior, posterior, and lateral diameter of the thorax. So, normally, the lateral diameter is up to twice the anterior-posterior diameter to a ratio of about 2 to 1. Next, I'm going to palpate the skinous process. They should be evenly spaced and non-tender. Next, I'm going to assess the respiratory expansion. So the movement is symmetrical. Please breathe. Next, I'm going to assess the tactile primitus or void sounds and palpate on the chest wall. Say 99. 99. 99. So, each location should feel equal vibrations. Next, I'm going to perform immediate percussion using the systematic patterns as resonance should be equal over the lungs. You should feel dullness over the diaphragm. Next, I'm going to assess the diaphragmatic exertion. Ask the patient to exhale and hold breath. Normally, the distance represents each diaphragmatic exertion measures 3 to 5 centimeters and equal on both sides. Next, I'm going to assess your kidney using blunt or fist percussion. Percussion in this area should not be cause tenderness. Next, I'm going to auscultate the breath sounds with the diaphragm. Normal breath sounds vary with the area you're assessing. You should hear bronchiovascular sounds between the scapula. So, I'm going to listen the abnormal sounds such as crackles and wheezes. Try to cough. So, crackles which can be heard on the respiration and sometimes on expiration results from collapse or fluid filled on the alveoli. If you suspect an abnormality, you have to say the patient 99. Normally, the words sound muffled and so I'm going to assess next your anterior thorax. Please turn around. Normally, they appear symmetrical and now no accessory muscles used. Next, I'm going to palpate your thorax. No nodules and tenderness fine. To assess the respiratory expansion, you should place your hands in the patterns. Breath. They move simultaneously and symmetrically. Then I'm going to assess your tactile premitus. Say 99.
99, 99, 99.
Vibrations should feel equal but stronger in the upper chest and lower chest. Next, I'm going to percuss over the lungs using systematic approach. Normal breath sounds vary with the area. Next is to auscultate over the patient's lungs. Normal breath sounds may vary within this area. If you suspect any abnormalities on the patient, say 99.
99, 99, 99, 99, 99.
Normally, the words sound muffled and indistinct. So next, I'm going to do an assessment of your cardiovascular aspect of the thorax. So, help the patient into semi-fowler position. Check the apical pulse. So, the apical pulse is not visible. Next, I'm going to palpate the apical pulse even if it's not visible. You should feel like short, gentle tap and should be palpable in an area 1 cm by 2 cm. Next, I will be using my ball hands and palpate the heart borders into sternoclavicular area, aortic area, pulmonic area, and left ventricle area. So, to note any tips of vibration. Next, I'm going to auscultate the heart at the right side, intercostal space close to the sternum. S2 is best heard at the base of the heart, corresponds to pulmonic and aortic valve, closure at the end of the ventricular systole. S1 is the best part heard in the apex. It corresponds to the mitral and tricuspid valve closure at the start of ventricular systole. Next, I'll be assessing your breast. So, in assessing the male patient, you should assess the breast. It should be smooth, no nodules and swelling. Then palpate the nipples and breast tissue, checking for nodules. You should not find any nodules. Then check the axilla. You should have no enlargement lymph nodes. Then next, I'm going to assess the female patient by inspecting the breast. One breast should slightly larger than the other one. The breast should be smooth with no redness, lesions, or dimpling. Lymph nodes in the vascularity or retractions. Then I'm going to assess your nipples. It should be symmetrical and no scaling, discharge, lesions, or bleeding. Then next, I'm going to raise your arms. Then I'm going to palpate the axilla. Small, freely movable lymph nodes are normal. Then I'm going to inspect and lie down here. Palpate each section and breast starting. Next, I'm going to palpate the nipple, compressing gently. You should not detect any induration or muscles. If you see nipples discharge, obtain a culture. Then, when you're documenting your findings, mentally divide the breast into 4 quadrants. Then, check the epitrochlear lymph nodes by palpating the groove between the biceps. Side rails, no nodes should not feel enlarged or tender. So, I'm going to wash my hands and remove PPE to reduce the risk. And that's all. And thank you, ma'am.